Hello everyone, it's Sophie here again with another video for you. Today's video is going to be all about toothbrushing. If you will have seen one of my previous videos, it was all about top tips for keeping your teeth clean at home, and the first tip was brushing your teeth. So today's video is going to be a more in-depth look on how you can actually brush your teeth well. I'm going to show you both electric toothbrushing and manual toothbrushing, and you can decide for yourself which method suits you better. But one of my most frequently asked questions in the clinic is, should I be using an electric toothbrush? And I would always say yes if you can, and that's because an electric toothbrush does a lot of the hard work for you and is a lot less technique sensitive. So I'm going to show you both methods. You can see both for yourself and you can decide which method is best for you, but we're going to look at electric brushing first and manual brushing just after. So we're going to go in first with electric toothbrushes. There are two types out there on the market. You've got sonic toothbrushes, which vibrate the bristles back and forth very quickly, and then you've also got oscillating, rotating brushes, which are a round head that twist and turn and also have vibrations in them as well. So both of those methods will break up the plaque, but I tend to prefer the oscillating, rotating brush, and that's because of the shape of the brush head. It's round and it's small and it fits really nice onto one tooth, which you'll see when I use it on the model, but they spin really quickly around, and that's what breaks up the plaque, and that's why it is a little bit more superior to a manual brush, is because it spins far more quickly than we can create humanly with our own manual brushes. So that's why I tend to prefer these. I'm going to show you the brush against the model and you can see for yourself what you think. So I've got my model here and my electric toothbrush, and one of the most common things that I notice that people do wrong with an electric toothbrush is they use it as though it's a manual toothbrush. So they get it against their teeth, they turn it on, and they do this kind of back and forth motion. But the way these are designed is to spin round to break up the plaque. So if you're also moving the brush, you're not allowing the brush to sit against the tooth and do its thing. So what you want to be doing with the brush is to just hold it onto one tooth and move it round a tooth at a time. You can get it to go all the way around the back of your molars. And I normally say to spend about 5 seconds on each tooth. So spending a few seconds on the front and then a few seconds round the back, and then bringing the brush round a tooth at a time. And you can either go round the front like that and then come back on yourself, or you can do like I was doing and do a tooth at a time. What I normally say to people to do is to split their mouth into 4. So you've got half at the top, half at the bottom, split those halves in half again, and then you do 30 seconds per half of the lower mouth and then 30 seconds per half of your upper mouth, and then in total it should take you around 2 minutes to brush the teeth. But that's how you use an electric toothbrush. And it does a really good job. So I can guarantee if you use an electric toothbrush and you haven't done before, you will notice a big difference with using this brush. But if you have got one and you haven't been using it like that, use it how I've just shown you and you will definitely see a difference. So this is going to be the manual brushing technique. In terms of a manual brush, I always recommend getting the smallest head that you can find. There are lots of ones out there on the market with extra bits added to it, being rubber or extra bristles, but that makes it chunkier and less precise when you're using it in the mouth. So the smallest head that you can find is easier to use, and then medium bristled. Hard can be too hard and can wear the enamel quite quickly if you're brushing incorrectly, and a soft brush can be too soft and can miss plaque and leave it behind. Unless you've been told otherwise, I would use a medium bristled brush. And what you want to do with your manual brush is to hold it against the gum at about a 45-degree angle, and you want to tilt it towards the gum line. So on your lower teeth you're going to tilt it down towards your gum, and on your upper teeth you're going to tilt it up towards the gum. And what you want to do with the brush is to just use circular motion, so you're almost mimicking what the electric toothbrush was just doing. And what you want to do is get the brush against the gum line and use a circular motion against the gums. And you want to do a tooth at a time, like we did with the electric brush, and using this circular motion to agitate the plaque and break it down. And you want to do the same on the inside. And you want to spend about 30 seconds per half again. On the biting surfaces, you can give them a good scrub. And then on behind these anterior teeth, you can tilt the brush upright and again do your circular motion. And that just means that it's getting more behind the shape of those teeth at the front. And you can do the same on the top as well. And you want to spend 30 seconds in each quadrant. What people tend to do wrong with a manual brush is they tend to scrub in a straight line. So they'll get their brush and they'll go scrub, 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 scrub. But if you actually look at your gums in the mirror, if I show you with this model, you can see that the gums are rounded in shape against the tooth. So they're kind of like a scalloped shape. If you brush in a straight line, you're going to miss these interdental, more precise areas, whereas if you do a circular motion, you're actually fitting the shape and the detail of the gum more precisely with your brush, and it's going to be more likely to get into those areas. So using a circular motion, tooth at a time, is the best way to be using your manual brush. So there you have it. They are the two methods that we have for brushing our teeth at home: manual toothbrushing and electric toothbrushing. Both manual brushes and electric brushes should be changed regularly every 3 months. So a manual brush should be thrown away every 3 months, and an electric toothbrush, the head should be changed over. So these ones, the head just comes off and you replace it every 3 months. And the reason why is because they become worn and they can become splayed, so the bristles are less effective at brushing away plaque, and they also start to harbour bacteria as well. They get a bit grubby, so they should be changed every 3 months so that they're effective and they're keeping your mouth nice and clean. Hopefully this video has been helpful for you, and next time I will be looking at interdental cleaning. So stay tuned for that video very soon. Keep safe, keep well, and hopefully we'll see you in the clinic very soon.